I want to tell you all about semaglutide, so let's get started. Before starting my patients on the GLP-1 or semaglutide, they complained of cravings, being addicted to sugars, carbs, a lack of motivation, feeling tired, low self-esteem, never feeling full. They were always hungry, and just going back and forth with the food and the eating and the inconsistency between the scale drain them emotionally and mentally. GLP-1s are weight loss medications that are considered the most effective choice of treatment. Semaglutide is a GLP-1, glucagon-like peptide, and it is a weight loss medication that is designed to reset the metabolism to ensure sustained weight loss over time. It's not a quick fix. GLP-1s are naturally occurring hormones that are made in our guts. They send a signal to our brain and other parts of our metabolic system to influence the blood sugar response and insulin. You may have heard about semaglutide as referred to as Wegovy or Ozempic. Those are the brand names. Now let's get to the science. What is a metabolic reset? Well, the GLP-1 medications work by lowering your metabolic set point. The metabolic reset is a whole body reset that sets up your body to have a healthy response to food, exercise, sleep, and other emotional triggers. When you have control over your whole metabolic system, you have control over your weight. This is how the medication resets everything. Personally, in my practice, we call it the total body reset. Our clients refer to it as that as well. Unlike any other medical weight loss medications, this medication is an injectable drug, and it targets the underlying pathways that to support the sustained weight loss. The hormone signaling works by regulating the appetite and digestion. You're going to feel fuller, longer, and also maximize the nutrient absorption. Now, most prescribers are prescribing the medication in tandem with moderate exercise or even also some nutritional counseling. In other words, you should know that, like I said, it's not a quick fix. You want to make sure you set realistic expectations with your clients. Studies show that participants lost between 10 and 14% of their initial body weight when using a GLP-1 in combination with the lifestyle changes over the course of a year. I'm going to go through a rundown with you of the benefits of the GLP-1s. Now, these medications work like the hormone in your body that we naturally make, and it gives us the following benefits: digestion regulation, fewer cravings, it's non addictive, it also reduces inflammation. It improves blood pressure, improves cholesterol levels, and also improves beta cell function. Most clients notice a big difference in about month 6, but from month 1 to 5, they notice a decrease in inches and a decrease in pounds. Now, you may be wondering, how do the GLP-1s increase and sustain weight loss outcomes? Well, when you change the diet and you also decrease the appetite, your patient is naturally going to take in less calories. They will notice a reduction in cravings. They also will notice increased motivation and energy. They will feel fuller quicker and better self control. Now, since the GLP-1s are clinically tested, they're stimulant free, and they are not habit forming. They're widely used and have been since 2005. Most people tolerate it well, but side effects, they are rare, but they can happen. Nausea is one of the biggest side effects. So people do complain of nausea, and we can treat that with Zofran. It is commonly resolved over the first few weeks after they get used to taking the medication. Constipation and diarrhea are also side effects that they may potentially have. In my practice, we combat constipation with Colace, and we also combat it with a smooth move tea. You want to let them know any side effects of allergic reactions, swelling of the tongue, itching, hives, feeling dizzy, weak, rapid heartbeat. swelling of the face, lips, or hands, any clay-colored stools, abdominal pain, fever or yellowing of the skin or eyes, to immediately go to the emergency room. Lastly, depression and thoughts of suicide are also another serious side effect of semaglutide. Now, just to recap, the most common side effects are going to be nausea, maybe constipation, maybe some diarrhea, maybe some mild abdominal pain, but nothing severe, headache, fatigue or tiredness, upset stomach, belching, gas, heartburn, feeling bloated, and maybe dizziness. I have had people complain of nausea. I haven't had anyone complain of diarrhea. So that is something that you want to be on the lookout for because it is a possibility. Now, is semaglutide safe? Well, when you start anyone on anything, you're going to complete a comprehensive intake. This is going to include the blood work, evaluating blood work, and talking about the medication, the side effects, and the risk of taking the medication with your patient. Everyone is not going to be a good fit. They need to take into consideration the other medications that the patient may be on, thyroid medications, diabetes medications. If your patient is an insulin dependent diabetic, then they would not be a candidate for this medication. When we start a patient on semaglutide, we administer the medication one shot per week, and we one shot builds on the next. And that is because we want to limit the potential side effects by taking time to see how their body is going to react to the drug. So the medication is started at a really low dose, 10 units to be exact, and every couple of weeks or weekly in the beginning, we just up titrate just a little until we get to the maximum effective dose for that patient or target dose has been achieved or side effects occurs. So if they are reporting that they're having an increased side effect that they didn't have previously, you know to bump them back down. And again, you know that this medication has been FDA approved and is shown to lower the body weight by 10 to 14% over the course of 6 months to a year. I'm going to give you a rundown of the importance of the labs and why they're needed. We are looking for renal function. We want to make sure their kidneys are working fine. We want to make sure their liver is working fine. If they have normal renal function, then it's okay to prescribe GLP-1s. If they have elevated LFTs, that may also be a reason why they would be a good candidate. They would be a good candidate if they are pre-diabetic, because we want to help them avoid going over to a full diabetic diagnosis. Looking at the lipid panel, we're looking to see if they have high cholesterol. If they have high cholesterol, then they will also be a good candidate. And lastly, TSH. We want to see if there's any other reason why they are struggling with their weight. Why are they obese? Does it have anything to do with their thyroid? We can rule the thyroid out if their TSH levels are okay. If they come back and the TSH levels are not clinically appropriate, then you want to have the patient discuss the result with the PCP and consider a thyroid treatment prior to medicating them with semaglutide, because that may also help them resolve the weight. Now, after going over the labs and talking about the labs with my patient, letting them know the importance of which, then I want to do a really detailed history. I want to make sure that this medication is going to do more benefit than harm for my patient. I'm going to let them know that semaglutide should be taken by itself, not in accompanying with any other weight loss medication. They want to increase their physical activity and also modify their diet. This medication cannot be combined with any other GLP-1, and it is not known if the medication is safe to be taken in combination with other over-the-counter weight loss medications or teas. I personally avoid using this in patients that have a history of pancreatitis, nor do I use it in children or anyone under the age of 18 years old. Lastly, big red flag. Anyone in the family or any patient that is going to present to you with medullary thyroid carcinoma is not a candidate for this medication. And people who have kidney problems, diarrhea, nausea, and vomiting can cause dehydration. And we know that if you have kidney problems and you're dehydrated, it just makes everything worse. We want to encourage our patients to drink plenty of fluid to avoid dehydration. And if you offer IV fluids in your office, you can also tell them that that is an option for them as well.